Critical appraisal. Is cognitive behavioral therapy an effective intervention in decreasing the severity of depression for patients with postpartum depression? 4 research articles were taken into consideration, and each of these were critically appraised by the group members. These were all randomized controlled trials. These are as follows. Randomized trial of psychological interventions to preventing postpartum depression among Iranian first-time mothers, 2015. Maintenance of the effects of cognitive behavioral and relational constructivist psychotherapies in the treatment of women with postpartum depression, a randomized control trial, 2011. Randomized controlled trial of therapist-assisted internet-delivered cognitive behavior therapy for women with maternal depression, 2016. Group treatment for postpartum depression, a pilot study, 1996. CASP for randomized controlled trials was used to appraise the article. The CASP for RCTs had a total of 11 questions. The group members grouped the questions accordingly from 1 to 6, 7 and 8, then 9 to 11. The first 6 questions are the following. Did the trial address a clearly focused issue? Was the assignment of patients to treatments randomized? Were patients, health workers, and study personnel blinded? Were the groups similar at the start of the trial? Aside from the experimental intervention, were the groups treated equally? Were all the patients who entered the trial properly accounted for at its conclusion? Majority of the articles met the criteria. However, for question number 3, journal 3, and 4, both said no. The patients, health workers, and study personnel were not blinded, which could have led to detection bias. For question number 5, journal number 3 and 4 both said no. Aside from the experimental intervention, the groups were not treated equally. The results could have been altered because there is bias, or there could be an advantage or disadvantage for the other group in the study. Therefore, the results would not be accurate. For question number 6, journal 1 said no, because not all patients were accounted for at the end of the study, resulting to attrition bias. Questions 7 and 8 asked, how large was the treatment effect? How precise was the estimate of the treatment effect? For the first journal, it stated that decreased level of depression. However, there is no significant difference. For the second journal, it stated that models of CBT and RCT were effective in maintaining a reduction of depression symptoms for 12 months, and 95% confidence interval was utilized. For the third journal, there is an effectivity of TIA-CBT, and there is a significant difference found. For the fourth journal, there was a significant difference in depression. However, the question is not applicable for the study. For questions 9 to 11, can the results be applied in your context or to the local population? Were all clinical important outcomes considered? Are the benefits worth the harms and costs? Journal 1 and 2 both can tell if the results can be applied in our context or to the local population. Most of the studies were conducted in different countries, and there was no available study that conducted CBT for patients with postpartum depression here in the country. Certain environmental factors and cultural differences may have affected the results of the study of the articles, which might also change its result when used locally. Decisions after critical appraisal. For Journal 1, the final decision of the group would be to accept the study because it would answer the group's research question. For Journal 2, the final decision of the group would be to accept the study because CBT as an intervention was effective. For Journal 3, the final decision of the group would be to accept the study given that it was able to meet most of the criteria of the CASP tool. In addition, the study was able to state that the intervention TIA-CBT was effective. For Journal 4, the group decided not to include this journal for the EBP because of the following reasons. First, the year of publication is dated 1996. Usage of old articles because it may no longer be applicable when used in the present time. There may be changes as to how CBT may have been implemented before. Second, the percentage of the attrition bias is greater than 15%. Third, the sample size of the population is too small to merit significant results. This is Group 1 of 4 OTB. Thank you and have a good day.